You've seen our research on social media. Now, join us as we dive deeper into the public health topics of our time, featuring new studies and findings generated by our faculty and researchers committed to advancing health equity. From the Department of Population and Public Health Sciences at Keck School of Medicine of USC, this is Preventive Pros, the podcast.
My name is Claradina Soto. I am Navajo and Jemez Pueblo, and I'm an associate professor in the Department of Population and Public Health Sciences. The topic of this important research is really to address the high prevalence of the diabetes among the American Indian and Alaska Native populations. Just for reference, there are over 570 federally recognized tribes in the United States. Much of my work is here in the state of California, where there are over 100 federally recognized tribes, and then we have a large urban Indian population. So the state of California has the highest American Indian population. So this is very important to address this particular health disparity. Right now, we have a project where we are addressing this topic here in Los Angeles County to address this with an intervention with American Indians living in Los Angeles County who are experiencing diabetes. There are many social determinants impacting the high rates of diabetes in our community. And we do have to think about the history that has happened with the American Indian and Alaska Native populations that still exist today, right? So there's the impact of colonization, the impact of forced relocation and discrimination, and how that has had an impact to the disparities of food insecurity, low income, poverty that our communities experience. And that's just to name a few, but we really do need to address and understand these social determinants to be able to address and understand why the rates of diabetes is so high in the American Indian and Alaska Native populations. So our goal to address diabetes in the American Indian and Alaska Native populations is to have culturally appropriate programs that really address the cultural needs of our communities with food and how to have better social connectedness with the community, how to reduce these feelings of social isolation, especially when COVID has really hit many of our communities in unfortunate ways. And so really to improve also the mental health well-being of our communities is to really have these programs geared towards our community, also in partnership with other American Indian organizations and agencies, but definitely also with Project Angel Food, who has been a really essential partner in being able to help with our intervention. So the intervention to reduce sugar levels and social isolation to address diabetes in the American Indian and Alaska Native communities here in Los Angeles County is we have an intervention that we've developed in partnership with the Project Angel Food here in La Hollywood and other Native organizations. So it's a 12-week program that includes virtual educational classes to learn more about diabetes, how to better manage your diabetes, and then we have medically tailored meals delivered to the homes of those experiencing diabetes who are a part of our program. And then they also have a social support system. So they have a buddy that they are able to help meet their goals of exercise, diet, better meals, etc., and to be able to have someone to engage with as they experience and be a part of our intervention program. So this intervention is really to understand if we are able to help reduce sugar levels and to just address the diabetes risk in the American Indian and Alaska Native populations. And so we really want to learn if these medically tailored meals being delivered to the homes will help improve diet, help reduce sugar levels, also again with the connection of having a social buddy, because if these do determine to have a positive impact, we want to increase and expand this to other tribal communities and other Indian populations, not just here throughout California, but throughout the nations and others who want to have a program such as this.
Preventive Pros, the podcast, is produced by the Department of Population and Public Health Sciences at Keck School of Medicine of USC. To learn more about any of our episodes, or to subscribe to our monthly Preventive Dose newsletter featuring the latest in public health research and news, visit pphs.usc.edu/podcast. Thank you for listening.